Hey everyone, the PDS dashboard of the month, PDS HCC completion dashboard. This is a dashboard that is run at the provider level. And if you'd like a clean copy of this dashboard, please feel free to visit our website where you can get a copy. HCCs, or hierarchical chronic conditions, are a subset of diagnosis codes which have been identified as conditions which require chronic care or a higher acuity of care and risk for patients that have these particular conditions. What we're trying to do with this dashboard is identify patients out there who have been seen and scored in order to get these risk levels so that we can look at it from a risk stratification standpoint within the practice. We can identify our high-risk populations. And in addition to that, hierarchical chronic condition scoring, risk scoring, is utilized for value-based contracting for reimbursement as well. So this is both a financial issue as well as a quality issue within the practices. This particular dashboard takes and identifies the number of unique patients within a provider's population. Now, this can be an individual payer that you're looking at, or it can be the entirety of the provider's panel. But we're looking at the number of patients within that panel, looking at the number of patients that have been scored with these chronic conditions. If they have these chronic conditions, each one has a risk score that is attached to that. And you can see these average chronic condition scores down at the bottom here. Now, these average chronic condition scores, anything less than a 1 is considered a low-risk patient. These are ones that probably only need to be seen once a year to do a wellness check and make sure everything's going well. Anything between a 1 and a 2 is considered a moderate risk patient. These are ones that probably have chronic conditions, but they're controlled and they just need to be seen to make sure that the care plan is appropriate, that they're compliant with their medications and the plans that they're put in place, things like that. So they probably need to be seen a couple of times a year. Anything above a 2 is considered a high-risk patient, and these patients are at risk for hospital stays or ER visits, things that would be considered negative outcomes. These are ones that we need to make sure that we're reaching out to and having and seeing them multiple times a year to make sure that the care plan is working appropriately for them and they're getting good outcomes from what we're looking at. So in order to do this, we need to make sure we're getting our patients in, and ideally we're doing this through the use of wellness visits, because that's what identifies all of the conditions that each patient has. So as you can see here, there are about 27 patients in this provider's population that we feel need to be brought into the office to be seen for a wellness visit and scored appropriately. Now, when we look at that, we know there are about 20 patients within this physician's population that haven't been seen, and we're anticipating that there will be about 7 more enrolled before the end of the year. So we want to be able to look at this and help with some outreach maybe to these patients to make sure that we're providing the best quality of care that we can get to. In addition to this, we want to make sure that our providers are getting their patients in and scored ideally at the beginning of the year. All of these risk scores are reset by the payers at the beginning of the year. So if we want to optimize our reimbursement from our value-based contracts, the sooner we can get our patients in towards the beginning of the year, get all of their conditions noted, diagnosed, and scored and communicated to the payers, the better our reimbursement will be. In addition to that, the care plans that we can set forth for the remainder of this year will provide better quality of care for our patients, making sure that we can treat their conditions in a state of wellness rather than a state of sickness where they may be going to the ER or to inpatient hospital stays. So ideally, we want to utilize this dashboard to identify our populations, help our providers see who still needs to receive some outreach to get them in, and utilize this to provide excellent care to the patients that we have. This is Dashboard of the Month for PDS. For a clean copy of this dashboard, please visit our website. Thank you.